Hi, everyone. It's Dr. Cristyn Watkins. Thank you for joining me. Today, we're going to talk about wellness medicine and hormones. So, without further ado, let's begin. I will probably talk a lot less, considering the fact that there's not 30 people in front of me to ask me a bunch of questions. So, we'll go ahead and get started. Okay, so wellness medicine and hormones. The big questions that I get asked a lot of times when I see patients or when patients are interested in what we offer here at aNu are, what kind of things do you treat? Why would I see you? There's literally a reason why everybody would probably see us, but some of the questions that come up are, do you have stress? Do you have low energy? Do you have thyroid issues, or do you think you possibly have thyroid issues? Are you having difficulty with weight loss? Are you having poor digestion or IBS or other GI issues? Are you having trouble sleeping, insomnia issues, such as that? Okay. So, as you can see, about anybody would have something on this list, and a lot of us have everything on this list. Okay. So when we start talking about wellness medicine, same thing goes along. There's a lot of symptoms that a lot of Americans have that traditional medicine is not addressing. Okay. So when I was in traditional medicine doing primary care, some of the main things that I saw patients for, and in particular women, were for fatigue, anxiety, and depression, weight issues, and then also things such as GI issues. Okay. And what we didn't know, what I didn't know at the time, is that there were underlying conditions and endocrine things that I could fix. So, do you have any of the following? You can read those along with me, but what you'll find is that a lot of us have multiple symptoms on this list. Okay. Fatigue, insomnia, anxiety, depression, hormonal changes or mood swings, hot flashes, night sweats, low libido, vaginal dryness, painful intercourse for men, erectile dysfunction, weight gain, high cholesterol, diabetes, heart disease, cravings such as sugar or carbs, also salt. Do you require caffeine to keep going? Do you have an afternoon crash? Are you tired in the morning? Do you have brain fog or memory issues? Do you have acne, wrinkles, skin laxity, and volume loss? That's not just topical or injectable like we do for aesthetics or laser, but this also comes from within, which we'll talk about. It's due to hormone loss as well as collagen loss. Chronic pain, migraines, IBS or GI issues, autoimmune conditions, or a hormone deficiency or a thyroid condition. Most of those, the vast majority of us can answer that we have some of those, if not all of those going on. Okay. So, how am I different than a pre-CP or a primary care physician? Well, I used to be a primary care physician. So, I have that in my background, which is actually very beneficial for my patients that come in with heart disease, diabetes, thyroid conditions, high cholesterol, because I know the medications that they're on because I was prescribing those for about 10 years. Okay. So I've board certified family medicine physician. I've kept my board certification, and I'm also currently certified in functional metabolic and nutrition medicine. And I need to take my board certification, which was actually supposed to be next week, but because of COVID, they have moved it. So I will sit for my oral and written board exam in August now. So what we do is here, my nurse practitioner, Amanda, and I, we treat the cause of your issues rather than the symptoms with pharmaceuticals. So if you can think of a tree, I call it the tree of life. If you can think of it that way, in traditional medicine, what we do is we treat the branches. So we treat the branches and we treat the leaves. And what the leaves are is those are symptoms of disease processes, which are the branches. Okay. So if you have a disease condition called diabetes, we're going to give you a diabetic medication. If you have constipation, we're going to give you a constipation medication. If you have high blood pressure, we're going to give you a high blood pressure medication. If you have a sinus infection, so on and so forth. Okay. The difference is that in functional medicine, we go back down the trunk of the tree and we actually look at the root system. So my job in functional medicine is to figure out the why or the cause. Why do you have diabetes? Why do you have heart disease? Why do you have chronic constipation? Why do you have anxiety? Why do you have a skin rash that won't go away? Okay. That's our job in functional medicine, is to actually find the cause and the why and fix the why. Okay, so during our appointments, we're able to spend a prolonged amount of time with patients, which is actually what is necessary to actually find the cause for what's going on with people. So we spend 45 to 90 minutes with all of our appointments, and that's one on one with the patient and the provider, whether it be me or my nurse practitioner. And a lot of times people will bring in one person in their life that can really help them on their journey to wellness or knows a lot about them. Okay, so during that time, we come up with an individualized wellness plan that is personal to every individual. I do not have two patients on the same wellness plan. Every single person has their own DNA, has their own social issues, so everybody is on an entirely different wellness plan. What we do also is we do comprehensive wellness and functional labs that take a much deeper look at physiologic function, nutrition, inflammation, hormones, and nutrient and vitamin levels. So patients will say, will my labs for my primary be the same? And the answer, unfortunately, is no, because in primary care, what we're trained to do is look at about four things: a complete blood count, a comprehensive metabolic panel, a TSH, which is a thyroid function, but it's just one of them, and then your lipid panel. That is what is included in an annual physical exam. Okay, we're not looking at nutrient levels, inflammation, hormones, things like that. So in functional medicine, we're taking a much deeper dive into what's going on. Okay, then we also have specialized labs depending on the patient, only if they require specialized labs, to look at GI function, microbiome, toxin levels, mold, Lyme, food sensitivities, etc. Okay, so this is another depiction of conventional medicine versus functional medicine. And I'm definitely not throwing my colleagues in conventional and traditional medicine under the bus. I still very much believe in traditional medicine. I just believe that we need to have a combination of traditional and alternative therapies combined. Okay, so conventional medicine is disease oriented, like we talked about with the leaves and the branches. It's doctor centered. Everyone's treated the same essentially. So if you have this type of pneumonia, you get this type of antibiotic. If you have type 1 diabetes, you get this. If you have high blood pressure, you get this. If you have high cholesterol, you get this. Okay, it is specialized, meaning what we've done in traditional medicine is we've given all of the organ systems to different physicians. So one physician gets the heart, one gets the lungs, one gets the brain, one gets the joints and the bones, another one gets the reproductive system. So what has happened is we've taken this unit, which is the human body, and we've separated that and given it to a bunch of different physicians and a bunch of different specialties. And there's not one person looking at the whole body as one system, which is in fact what we are, because we are just a combination of cells all working together, and they all absolutely talk to each other and work very synergistically. When something is wrong in one part of the body, there's a domino effect on everything else. Okay, so it doesn't really help us as patients, or as physicians for that matter, to take the body and separate it into different organ systems. We really need to think of it as a whole and look at the body as one unit. Okay, because what happens in one organ system affects all of the others. All right, so it's a diagnosis based on symptoms, which we talked about. And there's also early detection of disease versus preventing disease. Okay, so functional medicine is health oriented, very patient centered. My patient and I come up with a plan together because I need to know their social aspects and what they can do in life depending on their work, their travel schedule, their life, etc. It's very holistic. It looks at the underlying cause of disease, which we just talked about, which are the roots. It looks at biochemical individuality. None of us are made the same. All of our biochemical properties are different in certain ways. We've all been exposed to different toxins. We've all had different upbringings, etc., that very much change our cells and the way we work. And it's a very preventative approach. Okay, so my job is to make sure that disease processes do not happen as you age, such as diabetes and dementia. And if you already do have early signs of diabetes, is to reverse that process, okay, and to make sure that it doesn't continue to advance. So, have you ever been told that you are quote unquote normal, right? You've been to your primary care doctor, they tell you that your labs are normal. And what you're thinking is that you don't feel normal, okay? So, but they're very limited in what we can do in primary care because there's only a certain amount of labs that we do for screening. So what do we tell you? Go home, exercise, work out, eat better. The problem is that it's not necessarily the physicians that they aren't able to do something about it. It's that they're given 5 to 15 minutes with a patient and expected to address their diabetes, their depression, their insomnia, their weight gain, the toe fungus that they have, the other, the myriad of symptoms and issues that are going on. And they're given a very limited time how to address those. Okay. So what happens is the patient feels like no one is listening, and there is something not normal and not right, but those simple lab tests are not picking it up. Okay. So your doctor is able to tell you to go home, exercise, work out, eat better, and maybe here's Zoloft or Prozac or something that you can take to help with a lot of these symptoms that you're experiencing. So if you're seeking answers for vitality, health, wellness, and to get yourself back, wellness medicine is a great option, okay? So normal is not optimal, all right? If you fall in the quote unquote normal limits on LabCorp, Quest, hospital labs, etc., that does not mean that you are optimal. And a lot of patients realize that because they don't feel optimal. They're told their labs are normal. The problem with labs are that they haven't been updated for a very long time with optimal lab values or ranges. So for instance, a hormone level such as DHEA, lab values will range. They say that it is normal to be anywhere from 8 to 488. Okay, that's a huge lab range to be considered normal. All right, so my optimal range is about 150 to 250, which is very different than 8 to 488. So for traditional doctor not trained in bioidentical hormones, or functional medicine, get your DHEA level back, they're going to tell you that that level is normal. And I'm definitely going to tell you it is probably not, unless you're the lucky one that's in that very short range for me. Okay. So what are hormones? Hormones are proteins or derivatives of cholesterol that are manufactured in the endocrine glands. So I think it's very interesting. A lot of people do not realize that hormones are actually made by cholesterol. Okay. So there's a lot of people walking around this country in particular on statins, which are drugs such as Lipitor and Crestor that lower cholesterol. And the issue with some of those medications, there's a lot of issues. I won't go into all of them about the inflammation properties, but since we're talking about hormones, one of the main issues is that your total cholesterol has to be 140 for you to even make hormones. Okay, so if you are walking around and you're on these potent drugs such as Lipitor and Crestor to control your cholesterol, but it is reducing your cholesterol less than 140, you are not even making hormones, okay, from your endocrine glands. So these molecules are released into the bloodstream. They exert biochemical effects on organs and cells, and they affect every single cell in the body. So again, back to taking the body and separating it into different organ systems and giving that to different physicians is not exactly conducive to the best optimal wellness because everything affects every cell. Okay. So all hormones have different actions depending on the cell type in different tissues. And the main ones that we will focus on today are estradiol, testosterone, progesterone, DHEA, thyroid, cortisol, vitamin D, and of course there are many, many others, but those are the ones we're going to focus on. There's others such as pregnenolone, prolactin, etc. So why do hormones change? Well, aging, okay? So aging causes hormone changes, and this causes aging. So unfortunately, it's cause and effect, okay? The main thing that also changes hormones is stress. All right, we're definitely seeing this now with newer generations, my generation and the younger generation underneath me, the two generations underneath me, where we're starting to see a lot more infertility. a lot more polycystic ovarian syndrome, a lot more endometriosis, ovarian cysts, and things that are hormonal changes due to low progesterone and high estrogen due to stress. We're exposed to a lot more stress starting at a younger age, and that is therefore triggering hormone changes. All right, and in particular, I see a lot of infertility and endometriosis and painful periods. Okay, so it's happening at a much younger age than it used to. It's not just about menopause, it's also about women in their 20s and 30s, which I also take care of. So we also have, as we age, decreased production, and then we have decreased stimulation from our endocrine glands, and we also have cell destruction as we age. Okay, our stem cells start to decrease and our cells start to die. Our messenger RNA and our DNA start to change as we age. So what are bioidentical hormones? So they are for all ages. I just kind of alluded to the fact that I treat 20-year-old and 30-year-old women as well. So I treat for bioidentical hormones or hormone issues, usually starting in young females all the way up until women in their 80s, okay? So this can start at a very young age, or it can happen menopause or postmenopausal. Every woman is different with their biochemistry and their exposures that they've had with toxins, etc. So hormone changes affect everybody differently and at different ages. PMS, PMDD, infertility, perimenopause, and menopause, all right? So what is the job of bioidentical hormones? We're going to talk about that, obviously. That's what the topic is about today, but we're going to slow the decline of hormone loss, all right? What they do not do is they do not stop us at one age permanently. Wouldn't that be great if they did, okay? It doesn't reverse aging either. However, it allows us to stay resilient and vital. So it helps to manage those symptoms that we've been having, all right? And we can treat the underlying cause. So instead of treating your depression with an antidepressant, treating your weight gain with weight medications, we can actually treat the underlying cause, which is a decline in hormones, all right? So the key is to replenish deficient hormones to a youthful, optimal balance. So usually what men and women come and say to me is, I just don't feel like I should. I know I'm getting older or I'm aging, but this is not how I should feel at this age, whether it's 30 or 80, okay? So why do most doctors not prescribe hormones or tell me that they are not safe, all right? So most of us, the vast majority of us, do not learn about them in medical school because they are not pharmaceuticals. So what we're taught about in medical school is how to prescribe pharmaceutical medications, okay? We go to pharmacy class, and what we are taught literally is how to prescribe a medication for certain conditions, all right? So we have to do our own research and do our own certification and training because we're not taught in medical school, all right? They're also afraid of the Women's Health Initiative, which came out in the 90s, which really, really affected hormones because we were told that they were, all hormones were bad, okay? That's what we were told. That's what I was told when I was in medical school and residency, that all women should not be on hormones because of the Women's Health Initiative. The problem is that the Women's Health Initiative was misinterpreted, and the way that that data went out in the news, there was no social media at the time, the way it went out in the news and was presented to physicians is that all hormones are bad, okay? So the Women's Health Initiative trials, what they did was they ended the first phase of the trial in 2002. But what they were using was Premarin, which is a synthetic estrogen. It is not bioidentical estrogen, and it is derived from female pregnant mare, which is a female pregnant horse's urine, okay? So there are 10 different estrogens that are in there. There are many estrogens within synthetic Premarin, but there are 10 estrogens that are actually foreign to the human female body. All right, so there are estrogens that we don't even really know what they are when we are prescribing synthetic or pharmaceutical estrogen. That includes birth control, okay? That includes all synthetic estrogen forms. The study also had Provera and had Prempro. All of these are synthetic medications, okay? So what they found is through that study that it was increasing heart disease. You all have probably heard of this, increasing heart disease, stroke, and blood clots. However, what the study did not, what the media, I should say, did not tell us is that it was actually more so the Provera or the synthetic progesterone that was causing it, okay? And it was the fact that it was synthetic and not bioidentical. Okay, so what are bioidentical or natural hormones? They are not the same as synthetic hormones. Synthetic hormones are made in a lab and manufactured, and synthetic estrogen, as we just discussed, is made from pregnant female horse urine, okay? So natural is bioidentical. That means it's the same as your body makes. In order for it to be bioidentical, it has to be the same chemical and physiologic construction and property as what your body makes. So that is why we use compounders, because they are able to make the same properties as what we make as humans, all right? And why can a pharmaceutical company not do that? Pharmaceutical companies cannot make anything natural, and compounders cannot make anything that a pharmaceutical company makes. So the never two shall meet, all right? So it can't be made or patented by a pharmaceutical company. It's made with natural ingredients to make up certain things, okay? So it's ground up in a form of a capsule or a cream or a troche or an implanted pellet. And here at aNu, we do all forms because every patient is different and every patient has different needs, okay? So the thyroid. Thyroid hormone is secreted by the thyroid gland. It's a gland sitting in front of the trachea or where your neck is. It regulates basically everything, your entire body, okay? When your thyroid is not normal, every cell is affected. So it regulates temperature, metabolism, weight loss, bowels, brain function, fat breakdown, lowers your cholesterol, improves hair, thin nails, skin. It literally affects every single cell in the body, okay? When I do my functional training on thyroid or train other people, when we go over thyroid symptoms, when the thyroid is affected, it's about 20 slides of side effects or of signs and symptoms that can happen when your thyroid is not normal or not optimal, okay? Symptoms of thyroid issues: fatigue or lack of energy, feeling cold all the time or cold intolerance, weight gain, forgetfulness, confusion, depression, anxiety, thin hair, dry nails, dry skin. Constipation is a big one, arthritic type pain, muscle aches, cramps. Okay, that's just to name a few. So Thyroid Labs, what do we do different in functional medicine? So in traditional medicine, I told you that we check a TSH, which is a thyroid lab. Well, the problem is when we check a TSH, we're only checking brain function. We're only checking what the pituitary gland in the brain checks. We're not even checking what the thyroid itself is producing, all right? So in med school, we are trained to check a TSH, a thyroid stimulating hormone, all right? So what do we check in functional medicine is that we actually look at your T4, T3, free T4, and free T3, which are the hormones actually secreted by your thyroid gland. So if all we do is look at your TSH, all we're looking at is what your brain is secreting to your thyroid. It doesn't even tell us what your thyroid is making, all right? So what we do is we look at all of those hormone levels, your T3, T4, and free levels. We also look at your thyroid antibodies. So what we're looking for is an autoimmune disease called Hashimoto's thyroiditis, which unfortunately a lot of women have, all right? So if you don't check all of these levels, you'll likely miss subclinical hypothyroidism or thyroid insufficiency, okay? So I can't tell you how many times I have a new patient and they say, oh, no, you don't need to check my thyroid. It was just checked and it's normal. And probably about 40 or 50% of the time when I check and do a deeper level and check 7 to 8 levels of thyroid function, I actually find that there is either an overt thyroid problem or a subclinical thyroid problem, okay? Or Hashimoto's. We already kind of went through this, that TSH produces T4, T4 converts to T3. And the problem is that as we age, the conversion becomes less productive or less effective. So we do not convert T4 to T3 very well as we age. Well, in functional medicine, we measure your T3 and free T3, okay? So number one thing that physicians see patients for is fatigue and pain. And one of the main causes or symptoms, I should say, of a low T3 is chronic fatigue, Okay, so chronic fatigue is very much associated, studies have proven it, with a low free T3. All right, the problem is that even though Synthroid, levothyroxine, is the #1 prescribed drug in this country, which is thyroid supplementation, it is not T3. It only has T4 in it, okay? So if we're not good at taking T4 and converting it into T3, then we are actually not taking the proper medication, because T3 is what we need to go talk to all of our cells and what helps with thyroid symptoms, okay? So we do things different. We prescribe a more natural form of thyroid medication. So Armour Thyroid and Nature Thyroid are typically the ones that we prescribe. Sometimes we also do Cytomel, which is T3 alone, okay? So it's only by reaching higher levels of T3 that the symptoms resolve. And T3, like I just mentioned, has been shown to help treat chronic fatigue, okay? Estrogen. Estrogen is produced by the ovaries and the adrenal glands, primarily from the ovaries, but men do make estrogen as well, and men do not have ovaries. So estrogen comes from the adrenal glands in men, all right? They also produce estrogen from the conversion of testosterone. So it's very important that men have the appropriate level of testosterone given to them if they are given exogenous or prescribed testosterone, because if they are not careful and don't see providers that are monitoring the conversion of estrogen, they will start to convert excessive testosterone to estrogen and get hypogonadism, which is shrinking of the testicles. They will also get gynecomastia, which is where the breasts enlarge, and they will get more sensitive, okay? Not usually what men who are taking testosterone want. So estrogen benefits. This is for men and women, okay? Increased muscle tone, less wrinkles, dry, sagging skin, improved mood, improved libido, decreased Alzheimer's and dementia, decreased bone loss, and decreased risk of heart issues, because it actually decreases your bad cholesterol and increases HDL, which is probably the exact opposite of what most people hear about estrogen. And that is because what those studies are referring to, or the Women's Health Initiative study, was synthetic estrogen. That is not what we're talking about here. We're talking about estradiol, which is the bioidentical form, okay? So there have not been adverse events found with bioidentical estradiol, completely different than synthetic, okay? Progesterone. So progesterone is a female hormone produced by the ovaries and adrenal glands and is used to balance estrogen, primarily made in women by the ovaries, but again, men do make some of it in the adrenal glands. So men and women both have progesterone, it's just that women have a lot more. It enhances the action of estrogen to maintain a normal balance. And believe it or not, it is actually the first sex hormone to become unbalanced. So usually we're trained in traditional medicine, and a lot of us think that whenever we go through menopause, it's because we've lost estrogen. Well before that ever occurs is actually when we start to lose progesterone, which actually is starting to happen, as I mentioned earlier, in our 20s and 30s. And that is what is causing infertility, PMS, PMDD, mood changes. And then as we age and get to perimenopause, that's when insomnia and memory problems start to happen and we start to get irritable. So that happens typically well before vaginal dryness, hot flashes, and that's because progesterone is declining before estrogen actually does. All right, so progesterone, again, we're talking about bioidentical progesterone, not synthetic progestin, which is in pharmaceutical hormones, including birth control, actually offers protection against uterine cancer and breast cancer. It also reduces your total cholesterol, increases HDL, which is your good cholesterol, and halts the progression of osteoporosis, okay? Because it allows new bone growth. Progesterone is very much mood, sleep, and brain, okay? Very much helps to regulate mood, helps to improve insomnia, helps women sleep. It acts as a natural sedative, okay? So it's very, very, very important hormone. And when I see women with infertility, the first thing I'm looking at is progesterone, okay? All right, testosterone, males and females, all right? So a lot of people think that testosterone is just men. And vice versa, we already talked about the fact that progesterone and estradiol are also made by men. Most people tend to think that those are just female hormones. All right. Testosterone. Men do make about 10 times more than women do, but it plays a very important role in males and females. So again, secreted by ovaries and adrenal glands, in men, secreted by the testes and the adrenal glands. It restores energy. Okay, it increases exercise tolerance and enhances muscle tone, decreases fat, so it helps the muscle tone to fat ratio, enhances mood, well-being, zest for life, strengthens bones, prevents osteoporosis. Obviously, the big one that people know is that it increases libido and sexual function, but it also has very good effects on the heart and decreases cholesterol and increases HDL. It also decreases blood pressure and helps with cardiovascular risk. It actually decreases cardiovascular risk. The media will lead you to believe that testosterone actually will cause prostate cancer, cause heart attacks, cause stroke, cause increase in cholesterol, which is actually the very opposite of what is true. They are going off of very, very old studies. There was one study inappropriately done in the 1960s, and that is still the study that gets quoted. All of the studies since then on testosterone that were done placebo, double-blinded, have shown all of these positive effects of testosterone. And that also means when it is done at physiologic levels, okay? There is such thing as too much testosterone. We should only be prescribing bioidentical hormones to patients at a physiologic level, all right? We should not be over-medicating patients and giving them more than what they need or what they would naturally secrete on their own. That's when we run into problems, okay? All right, so the big thing on testosterone is, I always tell people, it is the feel-good drug. It is, okay? It gives us endurance, it gives us stamina, not only in the bedroom, all right, but also with our day-to-day life and the way we feel. Patients that are on testosterone notice the difference when they go off of it, okay? It definitely gives you that zest for life, and it definitely declines as we age. So DHEA is another hormone produced by the adrenal glands, made by cholesterol, as all the other hormones are. The important thing here is that it's a building block for estrogen, progesterone, testosterone, all right? It's the mother hormone, AKA the mother hormone. The problem is that most doctors do not check a DHEA. Even hormone clinics do not check DHEA, okay? Which I think is a big issue, because they're giving people more testosterone and more estrogen than is necessary and not checking the building block, two of them, which are DHEA and pregnenolone, okay? If you know the way hormones are made and the stereogenic pathway, you'll know that DHEA and pregnenolone are then converted into estrogen, progesterone, and testosterone. So if we go back up the tree and the pathway and we give people the appropriate hormones where they're needed, you don't need to put people into super physiologic levels or abnormally high levels of testosterone and other things that cause side effects, right? Because remember before I said that too much testosterone in men will convert to estrogen and feminize them, okay? So the New England Journal of Medicine shows low levels of DHEA with increased mortality from cardiovascular disease. Low DHEA is also associated with chronic inflammation and pain, all right? It improves immune system function, relieves stress, potent anti-cancer supplement because it's an antioxidant that prevents the formation of free radicals, which is essentially what causes aging and essentially what causes cancer, okay? Increases energy, reduces body fat, increases insulin sensitivity, protects against diabetes, and like I mentioned, very strong anti-inflammatory properties. So if all I have is a DHEA level, I can usually tell if somebody has autoimmune disease, because people that have a compromised immune function or immune system almost always have a very low DHEA, okay? So they have a lot of high levels of inflammation in their body, and they have very, very low levels of DHEA. I only see profoundly low, I won't say only, but the vast majority of the time, 99% of the time, when I see a very low DHEA, I know I have an autoimmune patient and I need to be looking for a source of severe inflammation, okay? So the Journal of Endocrinology and Metabolism, there are now at this point, there's over 5,000 papers documenting DHEA's benefits, but people who receive DHEA which a lot of my patients do if they need it, sleep better, have more energy, handle stress better, increased immune status, which I just talked about with autoimmune disease, anti-cancer effects, anti-atherosclerotic effects, meaning decreasing inflammation and buildup of plaque in the arteries, and then cognitive enhancement or better brain function, better memory, less brain fog, okay? Melatonin, a lot of people have heard of melatonin, all right? It is the sleep hormone, okay? But it does so much more. So it's secreted by the pineal gland located in the brain. It regulates sleep, all right? So the other thing, very interesting, I actually should have added this study in here, and I didn't even think about it until just now as I'm speaking out loud, but I've published, or excuse me, I have posted a few articles about melatonin and how it has enhanced immune system. Recently with COVID going on, everybody's looking for ways to improve the immune system, and melatonin has been proven to do that, okay? Why does it do that? It's very multifactorial, but what we know is when people sleep better, they have improved immune function, okay? So antioxidant effect as well for cancer and immune function, promotes better sleep and circadian rhythm, therefore helping immune function, decreases jet lag, and slows aging by promoting good sleep. Sleep is very, 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 very much related to aging, okay? One of the best things you can do is sleep, which we'll talk about. So melatonin is available by prescription and over the counter. Just FYI, over the counter is usually not 100% pure. So I tell a lot of people if they've tried melatonin before and it didn't work, that they should at least try the one that we carry. It's inexpensive and it is pharmaceutical grade, okay? It's medical grade. So a lot of times our melatonin will help when a previous one over the counter did not. Ours are pure and we have an extended release, okay? So there are some people for cancer being on melatonin that they are on up to 30 milligrams, up to 300 milligrams for anti-cancer effects. There's a lot of paper on melatonin for cancer. Again, it's about immune function, okay? Pregnenolone, one of the other mother hormones, contributes to brain activity. Pregnenolone is brain, memory, all right? So it supports healthy brain and cognitive function, improves memory, concentration, reduces brain fog. It's normally present in the body, and we should make it, but as with all other hormones, it starts to decline in production as we age, okay? Unfortunately, pregnenolone is not found in food, so once it starts to decline, you need to take it. And that's found, all of these are found by simple blood levels, all right? So lots of studies. There are thousands and thousands of studies if you search on PubMed and look for bioidentical hormones. But the bottom line is that women and men who are put on bioidentical hormones, all right, have a positive response, all right? The ones that were in a control group not on hormones had detriment or had increasing symptoms and increasing cognitive decline and increasing comorbidity and mortality, all right? So hormone treatment, as I just said, lots of studies have shown impressive and dramatic improvement in the decrease of symptoms, disease, and the improvement in the aging process. All right, vitamin D. Yep, it's a hormone. It is now classified in functional medicine as a hormone, and that's because it helps with so many things, such as depression, sweating, insomnia, inflammation, cholesterol, diabetes, okay? So it's very, very important. The lab levels that LabCorp and Quest and other places are using are very, very outdated. They say that the normal optimal range is 30 to 60, all right? That's very outdated. All of the new data says that the optimal level is that you are between 60 and 100, okay? So a level of 30 is not optimal, all right? So most of us are so deficient that all of us need to replace with vitamin D. I think I can count on one hand the amount of patients I do not have on vitamin D, and that is because we are also critically deficient in vitamin D. So the vast majority of my patients take 5,000 or 10,000 international units daily. I know it sounds like a high dose. It is not, okay? I have some patients that take 50,000 units 2 to 3 times a week to maintain their vitamin D level, and that's determined based on your labs. Cortisol. All right, cortisol is probably one of the most important hormones that I ever talk about with patients It's also the most difficult to adjust because it is the stress hormone, all right? And what a good time to talk about it in the midst of COVID, and also all of us starting to return back to work and to life, whatever that may look like, okay? So one of the most common health complaints today is the experience of fatigue and lethargy, all right? I'm tired, I'm exhausted, I'm tired in the morning, I crash in the afternoon. So those are all attributed, that is attributed to cortisol, all right? And attributed to stress. It's a stress response. So if you have fatigue along with other symptoms like difficulty concentrating, brain fog, inability to lose weight, anxious, allergies, weight around the belly, crashing, craving, all right, of salt and sugar, likely you have a cortisol issue, all right? HPA axis dysfunction or issues with cortisol is one of the most prevalent conditions, all right? It's also one of the most prevalent things I treat in my practice. So most of us experience it at one point or another, and most conventional physicians are not taught about it in medical school. I was absolutely not taught about it. I was taught about it for, I don't know, a couple of minutes, taught about Cushing's disease, and that's about it, okay? So we're not prepared to take it as a serious threat to health. And if I could tell you how many times by fixing cortisol I have fixed a patient, I wouldn't even know where to begin, okay? I even have patients that have adrenal failure that literally have no cortisol. They're not secreting any cortisol at all, okay? So that is something we definitely fix in patients. Symptoms, we went over this on the next slide, but tendency to gain weight, inability to lose it, especially around the waist, very, very common complaint as we age. High frequency in getting ill, infections that last longer than usual, tendency to have trouble when under pressure. So if you're somebody who tends to do well under pressure, and that starts to become more difficult for you, more difficult to handle multiple tasks, it's definitely a sign of a stress response and a cortisol problem. Reduced sex drive, lightheaded when raising from a horizontal position or standing up, difficulty remembering things, brain fog, memory problems, lack of energy in the morning or your afternoon crash, right? It says 3 to 5. It is also 2 to 4. There is a reason why Starbucks and other places have a happy hour from 2 to 4. So you can get your sugar and caffeine fixed because of cortisol, all right? You might briefly feel better after a meal, and then 1 to 2 hours later, you will crash again. You often feel tired from 9 to 10, you resist going to bed, and then you get a surge. So you might get a second surge around 10 or 11 at night, okay? You need coffee or stimulants to get going in the morning. You also need them to keep going in the afternoon. Cravings, increased symptoms of PMS or menopause for women or andropause for men. Pain in the upper back or neck for no apparent reason. You feel better when there's less stress, such as on vacation. A lot of your symptoms will go away. Difficulties getting up in the morning, okay? Hitting that snooze button all the time. You can go on to read more of these, all right? So most of us will find that we have a good amount of these symptoms. We tend to have more when we're more stressed, and as we age, as stress increases, whether stress on the body or stress in life, okay? So what are causes? We live in a 24/7, 365 world. We were not meant to live this way, all right? We were not meant to live in a society where we are literally running from a bear 365 days a year, all right? We were meant to have surges of cortisol and surges of stress, and then the majority of the time having a normal stress response. That is not what's happening, okay? So work pressure, changing jobs, death of a loved one, moving homes, illness, marital disruption. Obviously, those are the biggest stressors, but the vast majority of us are living in day-to-day stress of paying bills, raising kids, all right, going to school, having a job, those type of stresses, COVID, all right, whatever it may be. So adrenal insufficiency occurs when the amount of stress exceeds the capacity of your body to be able to compensate for that, all right? So the problem is that almost all of us in America and Western society have this problem. The other thing is that we do not follow the pillars of functional medicine. The 4 pillars of functional medicine are nutrition, physical activity, proper sleep, and managing stress. All right. So when we don't do these things right, we tend to have stress issues and an improper cortisol response. Okay. Other causes. These are all things that can cause an issue with cortisol. So as you can see, everything we've been talking about overlaps. Okay. An interesting one is excessive exercise. Functional medicine physicians are the only ones who will tell you to exercise less. You need to listen to your body. If you are running 5 miles a day and when you get done, you are exhausted, or you need to take a nap, or the next day you are exhausted, you have adrenal issues and you need to quit exercising so much. Your body is telling you that you do not have the reserves to do that, and you actually need to not exercise as much, and you need to give your body some time to repair. You need to focus on stress changes, sleep, and nutrition. Okay. So what happens to the body when cortisol is lowered due to dysfunction? We start to get insulin resistance. We start to get problems with blood sugar, hypoglycemia, meaning low blood sugar, or feelings of low blood sugar. We start to get immune issues. So we start to get infections, all right? We start to get more outbreaks of herpes, cold sores, we get yeast overgrowth, we get viral and bacterial infections, we get a lot of inflammation resulting in myalgia or muscle and body aches, we get fat around the waist and protein breakdown, which causes muscle wasting, inability to reduce weight, and that weight around the waist, okay? Increase in water and salt retention, which causes high blood pressure at first, and then a lot of my patients will present with low blood pressure as the condition worsens, okay? So initially high blood pressure, which then turns into low blood pressure. Estrogen dominance leading to PMS, uterine fibroids, and breast cancer. Okay? So what do we do to help treat cortisol issues? Dysfunction can be reversed. The problem is it takes time to reverse cortisol issues because we've been running from the bear and stressed for a very long time, right? So some of the important steps: sleep, nutrition, just like I talked about, these are the 4 pillars of functional medicine. These are the 4 things I teach my patients how to modify: sleep, nutrition, physical activity, and stress reduction, okay? So sleep, it's important to go to sleep by 10 p.m. every night. It's because our adrenal glands kick in for a second wind if we're up past then, and they keep us going from about 11 p.m. to 1 a.m., and that puts a tremendous stress on the adrenals, okay? The other thing is that our brain is really trying to repair the body between 10 or 11 and between 1 and 2 a.m. So if we are awake during that time, we are not getting brain and body repair, all right? So we also need to try to sleep in. So between 6 to 8, obviously most of us cannot sleep in until 8 a.m. This is one of the reasons why daylight savings time is so hard on us, because it changes the time when our body naturally wants to wake up. It changes our diurnal rhythm, all right? So it's really important for us to try to get 7 to 9 hours of sleep if we can, because that is when the brain repairs. So at night, cortisol is at its lowest, repairing the brain, and melatonin and growth hormone are at the highest, allowing us to sleep and allowing us to repair, okay? So in later stages of adrenal fatigue, the level of cortisol falls and we start to feel tired. Hard for us to wake up. If we wake up too early, it increases stress on the adrenals, makes us make even more cortisol. So if you're unable to sleep, there's a lot of things that we carry at aNu, such as L-theanine, melatonin, magnesium. Some of my favorites and staff and patient favorites are something called Cortisol Manager. Cortisol Manager really helps the brain and the body relax in the evening so you can get sleep. It really is a miracle supplement. You can ask my staff, you can ask all my patients. It's one of our most popular supplements because it's natural. You can take it forever and it helps the brain and body naturally sleep at night, okay? Sleep is one of the most important things we can do for hormone production, for stress regulation, for weight, okay? Avoiding caffeine. So coffee and tea act as stimulants and they interrupt sleep pattern. So again, back to the happy hour at Starbucks from 2 to 4. What we do is we get that afternoon slump because we're not sleeping well at night. And so when we get that afternoon slump, we consume caffeine and sugar. And then we get a second wind at night that keeps us awake. So the next day we do the same pattern and the same pattern and the same pattern. okay? Avoiding electronics at bed. So trying to turn off your phone, television, computer, whatever it may be, around 9:30 or 10, okay? So the crazy thing about blue light, which is all of those devices, is that it impairs melatonin production. So by having those devices and using them after 9 p.m., we are lowering our melatonin production and inhibiting our normal sleep pattern, okay? So a lot of people will wake up in the middle of the night, can't fall asleep, all right, or wake up tired. So electronics have a big effect on that. Not only is it increasing cortisol at night where you're more stressed because you're still doing work and other things in social media, which are dopamine provoking, okay, and cortisol and stress provoking, but you're also, the blue light is inhibiting melatonin production. Physical activity, wonderful stress reducer, tremendous oxygenator, helps with depression, increases blood flow. By increasing blood flow, we also help to detox the body, normalizes cortisol, insulin, glucose, growth hormones, thyroid, makes you feel generally much better. The caveat to that is if you exercise too much and you feel fatigue, you need to back it down. So most people need to exercise for about 30 minutes, 3 to 5 times a week, doing something like walking, elliptical, cycling, or doing HIIT, okay? You do not need to run from the bear on a treadmill for 5 to 10 miles every day, okay? I always tell patients you cannot exercise your way out of poor nutrition, and you cannot supplement your way out of poor nutrition, right? So when you're a wellness patient, I typically check all of your labs and put you on optimized levels of nutrients for you individually, okay? But if you're not able to become a wellness patient, there are things that you can do to help the adrenal glands. And that includes vitamin C, B complex, glutathione, multivitamins, CoQ10, omegas, magnesium, and probiotics. And with all of the COVID things that you've been hearing, and if you follow my blogs or you read emails or the posts that I've been posting, you'll know that there's overlap in that with anything that helps to support the immune system. So I'm sure none of us are surprised that stress profoundly affects the immune system, okay? Which is why supplements and nutrients that help the adrenal glands and our stress response also help immunity and the immune system. 100% overlap, okay? So the other thing that helps, a lot of patients say, well, if I do those things while I'm working on my sleep and my stress and my nutrition and my physical activity, because those things are really hard to work on, and that's what we're really bad at in America, what else can I do? All right, so I carry a lot of adaptogenic herbs. So we carry probably 5 to 6 different adaptogenic herbs, and what those do is help to increase cortisol production appropriately by the adrenal glands. And most of my patients are very, very happy when I put them on adrenal glandulars and extracts because it helps them with brain fog, with memory, with cognition, with mood, with energy. Okay? The other thing is removal of stressors and stress reduction. I know this is not easy. I also know that I have a lot of stress in my life, okay? So what do? I'm not going to change my life. I'm a physician. I have practice. I'm very busy in my practice and running the company. I also have 3 small kids under 7, okay? So what we need to do is find ways to modify our stress. So what does that look like? That looks like eating right, getting sleep, going to sleep at an appropriate time, okay? Turning off electronic devices, not doing too much social media, not watching the news if that's a stressor, going for walks, doing a hot bath, doing yoga, doing meditation, going for a massage, okay? So it's very, very important that we do things to modify our stress level. Every study that has been done on meditation has proven that it changes our stress response and actually changes the neurotransmitters in our brain, okay? So even if you can do 5 minutes a day, studies have proven that 5 minutes a day of meditation can help, all right? And you don't have to meditate kumbaya. You don't have to sit there, all right? The way that we think of meditation, you can do things such as breathing. stretching, journaling, reading, walking, looking outside at nature while you enjoy a cup of tea, all right? Doing a hot bath. It's a ritual that allows you to have quiet time and to reflect. That is what meditation is. It's looking inward instead of looking outward at the chaotic world. All right. There's a lot of journals and books that you can do on Amazon. I like one called 365 Days of Mindfulness. It's just a little book where you read your intention for the day. So it can set your intention for the entire day. And these small things definitely have a profound effect, even based on studies and brain imaging. When we look at them, whenever people are doing things such as meditation, contemplation, quiet time, right? Again, one of my favorite things is the Calm app. There's tons of meditation apps now. When I started functional medicine 4.5 years ago, there weren't very many. So I really like the Calm app because they've got guided meditations. They've got breathing where you can do 5 minutes of breathing. It's pretty awesome what you can accomplish in 5 minutes to change your stress response. Okay. Some resources here, what I talked about, the Calm app that you can get on your phone. The Miracle Morning. There's some really good online resources if you just want to snap a picture of this slide. I really, really think it's important if you can incorporate this even a couple minutes a day. Okay, it's a great way to lower our stress, and it's only a couple minutes a day in the chaotic world that we live in. So the basics of optimal health and wellness: nutrition, sleep, stress, and physical activity. Those are the pillars of functional medicine. Underlying that are other things that I fix in functional wellness medicine, such as gut health and detox, nutritional, vitamin, and mineral supplementation, because those are the things that fuel our cells. And our cell's job is to create ATP, which is energy, and detox. Okay. And then natural bioidentical hormone replacement therapy. All right. A lot of us need hormones, and it's because we are aging. We have free radical and oxidation and damage that are causing us to have lower hormone levels. Okay. So when I optimize a patient, I look at this entire picture for a patient in order to optimize them. That's what we do in that first 90 minutes when I meet a patient. Then we decide what labs we're going to do. And then I bring the patient back for another 90 minutes and make their plan. I make an individualized wellness plan based on all of these things, their history and their lab work that comes back. So it's very important to realize that we are not just our diagnosis or our symptoms. It's about social stressors, emotions, intellect, environment, physical things, occupational, and spiritual. Okay. So wellness is all encompassing in all of these things, which is why we need time to spend with our patients. Because if I don't know your social stressors and I don't know how you sleep and I don't know what triggers your stress, there's no way I can make this wellness circle complete. Okay. So it's really important that I look at those things and I look at all of them so that I can find optimal wellness for each and every one of my patients. Okay. So if I cannot come in to see Dr. Watkins, what can I do? So we talked about some of the supplements that can help. We talked about sleep. Nutrition is one of them, but I could talk another hour about that. And this talk is already an hour. But cleaning up nutrition. So eating organic when you can because there's less toxins, low carbs, wheat, sugar, processed, and alcohol. All right, because those are the foods that have additives, are processed, have toxins in them. Daily supplements right now until we reopen, so until Friday, all the supplements are still 20% off with free shipping over $150 or curbside pickup. We're doing our 15-day detox program. It's a kit that has 2 shakes a day and detox packets with it. And I recommend that to do 1 or 2 times a year. Usually I do mine in January and after the summer, but with everything that's been going on with a lot of people in COVID hibernation, the month of May, we're doing it for $199. And that actually includes the entire kit for 15 days, which is 2 meals a day, plus your supplements. Also includes weekly sauna and weekly turbo shots. Other things you can do are turbo shots, obviously reducing your exposure to toxins, meds, pesticides, okay? Obviously physical activity, we talked about that, proper sleep, turning off social media, turning off electronics. Okay, so if this is something that you're interested in, please email me at drwatkins@anuaesthetics.com so that I can direct you for appropriate paperwork or to come in for consultation with our patient care coordinator or talk to one of my staff about getting in for wellness. Or if you have a family member or somebody else, please direct them our way or have them email me. Okay, so it's one of my favorite things I get to do in life is to practice wellness and functional medicine, nutrition and hormones, because it makes us partners together. It makes us partners as physician and patient together, all right, in our health, which is very different than what I used to do in traditional medicine. So I like this slide a lot. Discover life-changing wellness. That is what Amanda and I do. We do that with hormones, with gut regulation, with the 4 pillars of functional medicine, and with nutrients. Email me at Dr. Watkins at aNu Aesthetics if you have any questions or if you want to talk further. I've probably given you more information than you could ever want with an hour of talking, okay? Does anybody have any questions that they want to type in? If you want to, feel free to. You can type those in. Usually it's on the bottom right-hand corner. If not, everybody have an absolutely beautiful day. All right, it's 5 o'clock. I think everybody's probably ready to go home. Let me see if we have a question. I think we might. Oh, technology, I tell you. Let's see. Okay, what are your thoughts on COVID and the seriousness of it? Oh, goodness. I could talk for hours and hours and hours about COVID, okay? I think the real answer is that we don't really know, all right? We don't really know. I was actually going to start testing all my staff and patients for COVID. And the problem is that we don't even know what the IgM and IgG antibodies mean quite yet, okay? So I started testing some patients and their IgM antibodies were coming up positive when their IgM, IgG antibodies should already be positive and they weren't. So I think the answer is that right now we don't know. I think it's very, very serious for the people that get it and get respiratory issues and are intubated. Absolutely 100%. But I don't think that the numbers in America are as high as they anticipated or predicted. Okay, I can tell you that for sure. As far as seriousness, I think we all have to take it seriously, but I think time will tell. I don't think that we have the answers yet. It's still such a new disease process that hopefully we have some answers soon. I know that as a medical practice, we have to take it very seriously and we have to do a lot of precautions when we open on Monday, which is going to affect business, but it is what it is. So I think as time goes on, I will continue to do blogs and posts about COVID. So I know that's a very vague answer, Kelly, to your question, but I think time will still tell. Every time I think I have an answer about COVID, I read new studies and there's something else. What I think is really important about it is increasing your immune system, okay? And we have a lot of ways to do that with supplements, obviously controlling stress. It's one of the most profound ways that affects our immune system. So everything that I talked about actually will definitely help to increase immune function and decrease seriousness when we get infections. So the serious nature of them for all of us. Okay. Any other questions? I got a question about what type of appointment do I need to schedule to find out the root information concerning my body. So when you call, we can give you information. You can either email me, Dr. Watkins at anuaesthetics.com, or what we can do is you can give us a call at our office and talk to one of our front desk. And what they'll do is get you set up and give you all the information for a new wellness appointment. It's a 90-minute appointment, either with my nurse practitioner or myself, and those prices are different depending on who you would like to see. But we both do the same thing. She's trained by me. She's also trained by my same certification and board certification medical school that trained me. All right, just depends on which one of us you want to see and what works better for your life. She's definitely, I'm booked out usually a long time, so it just depends on what works for you. Thanks for that question. Anyone else? Has everyone you've worked with that has Hashimoto's also have adrenal issues? I will tell you in my practice 100%. Yes. All right. I don't have an autoimmune patient that does not have adrenal and cortisol issues. Okay. I can say that with certainty. There's pretty much no way your immune system is that profoundly effective that you have an autoimmune disease that hasn't triggered a stress response in your body and you don't have adrenal issues. Okay. Any other questions? Okay. I'm going to give you a little poll. Basically, did you find this webinar helpful? And do you want me to ever offer more webinars? If you'd like to answer that, go ahead. If you don't want to, that's fine as well. I don't know who answers what. So if you hated this webinar, I won't know it was you. So you can say no if you didn't like it. Okay. But if you do want me to offer more webinars, obviously I usually do these talks live. I do them here in the office, but I think that that's going to change for a little bit. So if you would like for me to offer more webinars talking about things like medical weight loss and peptides and regenerative medicine and all these crazy things that float around in my brain, I would love to do more if that's something that you all are interested in. Okay, I love to talk and share the things that I've been gifted with, which is to share medical knowledge. And part of that is because, as most of you know, I'm a patient myself. I've been a patient my entire life and have autoimmune disease. So I think sharing this knowledge is really, really important, whether you see me as a patient or not. It's more about sharing because I think information is power. Okay. Another question, is it harmful to go on and off birth control pills? Currently taking Yasmin for acne, but would like to get off of it. Once on bioidentical hormones, does a person take them for life? So it's not that it's necessarily dangerous to go off and on, okay? It's that in general, birth control pills, what birth control pills do because they are synthetic is they turn off our pathways to make our actual hormones. So I don't even typically check labs on a patient who is on any form of hormones or birth control because it will show that all your hormones are depleted or almost zero. And that is because it blocks the hormone pathway. It blocks the conversion of cholesterol to pregnenolone, to DHEA, to testosterone, and cortisol and estrogen and testosterone, okay? So when you take birth control or take synthetic hormones, it blocks that pathway, which is why you get libido issues, right? It's also why it helps your acne. Why does it help your acne? Because it stops from producing DHEA and testosterone. That's not exactly a physiologic process that we want to stop. We don't want to stop making testosterone and DHEA, okay? We want to control acne in other ways. And acne in functional medicine comes from the gut, okay? It comes from what we eat. It comes from inflammation, all right? So it's not that going on and off birth control is necessarily the problem. You can just immediately stop it. And the other thing is, once on bioidentical hormones, does a person take them for life? That depends on the person, okay? If you have an underlying autoimmune disease that I can help fix, if you have underlying gut things that I can help fix, not everybody needs hormones for life. If we can adjust the underlying causes, okay? However, if you're on hormones due to postmenopause, most women do take them until they're kind of done with that vitality part of life, because remember, hormones only continue to decline as we age, all right? I wish we would wake up at 60 and just get more of them, but unfortunately we don't, because we continue to age and our DNA continues to change, okay? Any other questions? Okay. If anybody has more questions, obviously, please feel free to email me, Dr. Watkins at aNu Aesthetics. Thank you, everyone. We had a lot of participants. We had a lot of people listening today. So I'm glad I did this. And everybody have an absolutely beautiful rest of your evening. Okay? Bye-bye.